Hello everyone, welcome back to our channel. Let's start by thanking you guys so much for watching our previous video and for subscribing and liking our channel. From the bottom of our heart, we say thank you so much. Okay, so we got a lot of comments, we got a lot of questions. The biggest question and the biggest comments that we received were from people who failed the NCLEX the first time or the second time or the third time, and they're all panicking. They wanted to know what can they do to pass the NCLEX the next time, what would they need to do, what are some of the tips that we can give them to help them pass NCLEX the next time around. So let me start with the people that failed NCLEX. I don't want you to fall into the myth of thinking that because you failed NCLEX the first time, you're not going to pass NCLEX again. Or people that failed NCLEX the first time have a lower chance of passing NCLEX the next time. Those are all myths. Those are not true. Now, let me say this to you. Granted, once you take the exam and don't pass the first time, you're going to be filled with a lot of anxiety. You're going to be filled with anxiety, and if you don't manage your anxiety well, when you get into the exam hall, that anxiety is going to affect your ability to concentrate and your ability to focus on answering the questions. So here are some tips that I'm going to give you if you failed the exam or if you are taking this exam for the first time. Let me start with the people that failed the exam. A lot of you guys, a lot of times when nurses come to me, they come to me with their test result analysis. So as you guys know, if you failed the exam, NCSBN or the Board of Nursing will send a text analysis to you, showing you the areas that you did well in and the areas that you were lacking in. They usually tell you if you pass or if you have near passing. So nurses will come to me and they will be so fixated on this test result analysis. And this is what I always say to them. I will always say to the nurses, the only way I will focus on this in my teaching for you will be if NCSBN promises me that they will give you the same exact exam that they gave you, the same exam that you took previously. If the answer to that question is no, which I'm 100% sure is going to be no, then the test result is important for me to know your areas of weaknesses, but it's not going to be my total guide for training you. So when nurses join my class, this is what I say to them. I say to them, although it's important for you to look at your text analysis, I want you to cover your content in its entirety. I don't want you to just focus on those areas of near passing or low or below passing. Those are important to me, but they should not be your only focus. You should still cover your whole content. Now, when they come to me, this is what I also say to them. I don't care what you did prior to you coming to my class. I don't even care how many times you've taken this exam before. That's not important to me. What is important to me is what you do from the time you join my class, and kind of help you to get rid of some of the myths you have in your head, and in most cases we might need to help them to unlearn what they have learned about NCLEX to be able to pass NCLEX, right? So here are some of the tips that we give nurses, the ones that have taken the exam before and the ones that are planning to take the exam. Tip number one, it's very important for you to know yourself, and it's also extremely important for you to understand that NCLEX is not an exam that you take by studying a few days before your scheduled exam. It is also important for you to understand that NCLEX is a critical thinking exam with now integration of clinical judgment. So it's one thing for you to theoretically understand the topics, but it's extremely important for you to also understand the applications of the theory, the topics that you've reviewed. So what I tell my nurses or the candidates in my class, I always say to them, you need to, when you're reading NCLEX, like let's say you're studying a diagnosis like asthma, you must close your eyes and you must be able to imagine what that disease process is. What is that disease process? What does it do in our body? What does it do to your body when you have that disease process? And what are you going to do to manage that disease process? For instance, if you have asthma, if a patient has asthma, you know there's an inflammation process going on as well as bronchoconstriction. So your focus is going to be on things that you need to do to manage inflammation, as well as vasodilators to help dilate bronchodilators to help dilate the bronchioles. So now, if you just read about asthma and you don't understand that simple context about asthma, you're going to struggle. You will just go into the exam hall memorizing everything about asthma, but then when you get to NCLEX is going to ask you more questions on applications, your ability to apply what you have studied, right? So if you miss it there, you end up with a problem. Now, according to NCSBN, this is not from anyone else, I heard it directly from NCSBN. They said 100% of the questions you get during your NCLEX are going to come out of skills and tasks that are assigned to nurses who have only been in the hospital for 1 year. What that means to me, or what that says to me, is this: that NCLEX actually tests the most basic level of nursing that you can ever encounter. So a lot of times when I see nurses come to me. These are very intelligent nurses. Some of them are internationally trained. Some of them were in other professions before transitioning to nursing. I see that they study NCLEX on the highest level you can think about. Some of them will memorize pathophysiology of NCLEX. They will memorize all the medications on all the medications you can think of in this whole world. Pharmacology, it's like I have to understand every aspect of pharmacology. I have to understand every aspect of the pathophysiology of the disease, which are also very, very good. But you're being tested on the most basic aspect of nursing, right? So what does that mean to you? That means that it is important for you to understand that you're not the physician. You're not the one that's going to diagnose and treat. Your job as a nurse is going to be on on assessment, intervention, and evaluation. So when you're studying for NCLEX, I always tell nurses it's good to know the anatomy and physiology. It's good to know pathophysiology. It's good to know pharmacology. But you're mostly going to be tested on your ability to assess your patients, your ability to recognize when something is going on with your patient, when the patient is declining in any form or shape or improving, your ability to intervene if there's need for intervention, your ability to evaluate, and your ability to document all that you have done for that patient throughout the period of time that you're caring for that patient. So when you're studying, your focus should be mostly on your scope of practice as a registered nurse. And tip number 2. Now you've understood that the computer is basic nursing and there's computer adaptive testing. A lot of you guys will have a heart attack if you get cut off on 75, or if you don't get cut off on 75. Like if you get to 75, which is the minimum registered nurses will get, if the computer thinks that you have mastered the content at 75, the computer will cut you off. If you don't get cut off on 75, don't have a heart attack. That means you're actually not doing very badly. That means that the computer thinks there's a chance that you can pass this test and is giving you opportunities to pass this test. So if you don't get cut off at 75, that's a good thing. You should celebrate it and stay focused and continue answering your questions. And while you're answering your questions, don't ever answer any questions without understanding what the question is asking you to do. A lot of nurses will come to me and they will say, oh, I got cut off at 75. I knew all the topics, but then I still fell. Because a lot of times we answer the questions without knowing exactly what the question wants us to do. So I always tell nurses, make sure you understand the question before you answer the question. Whether you get cut off at 75 or not 75, still stay focused and continue answering your questions. Okay, so here's our tip number 3. Our tip number 3 is this. I know A lot of you nurses who have 1 million resources that you're reviewing with. And I always say this to nurses, you don't need everything in the whole world. What you need is one class, a book, and a text bank. A text bank of your choice. You need to have a class, you need to attend any class that you want to. You need to have one book that the class that you're attending recommends, and then you need to have access to a text bank, right? Those, if you use these 3 materials, I guarantee that you will pass. But if you surround yourself with all the materials in the whole world, you're going to confuse yourself, and you're going to end up not passing the exam. Because like I said, management of asthma, management of pneumonia, management of heart failure, management of MI, they're all going to be the same depending on the book that you're using. I mean, they're all going to be the same across books. So one book is not better than the other. You just need to focus on one. Learn your content. You must learn your content. Learn your content and be able to apply your content, and you should be good. So regardless of what you're doing, you don't need a lot of books. You don't need a book that teaches you how to answer select all that apply. Select all that apply is content based. If you understand your content, which is what I tell my nurses when they join my class, once you understand your content, you will be able to answer the question regardless of how they throw the question to you. So please, you don't need a lot of materials. Kind of reduce the number of materials you're using and focus on the ones that you find effective for you. Okay? So tip number 4, if you have mastered your content, you've spent enough time understanding your content, now you can start using your text banks. I always recommend for nurses to answer at least 100 questions daily a month to your exam. When you are a month away from your exam, you can start answering at least 100 questions daily. And I always tell nurses, don't answer the whole 100 questions at once, because that could be boring, you will not have the strength to finish it. Do maybe 10, 15 at a time. 10 questions here, 15 questions there, 20 questions there, until you complete that 100 to 150 questions per day. Stay focused on systems. If you're answering questions on cardiovascular today, make sure you focus on cardiovascular. If you're doing neuro, make sure you focus on neuro. If you're doing GU, GI, answer as many questions as possible. If you pay for a text bank or someone else pays for a text bank for you, make sure you complete the questions on that text bank before you go to take your exam. So a month or a month and a half to your exam, you need to be answering text bank questions. That will help you with application. Remember, reviewing the chapters, reviewing the topics, the contents will teach you about the content and you master the content, but you still have to be able to apply what you have studied for you to pass NCLEX. And that's going to take us to tip number 5. Alright, so this is tip number 5, the last tip of the day for this video. We'll give you more tips in the future. Tip number 5, surround yourself with positive energy. Please, if you have friends who have failed this exam and they're always on your ears, I failed this exam, you don't want those people around you. If you have anyone that depresses you or anything that makes you sad, you need to get rid of all of those things while you're studying for your NCLEX. You must surround yourself with positive energy at all times. And you do this by understanding who you are, understanding the things that irritate you or the things that give you happiness, and focus on the things that give you happiness. This is important because for you to pass NCLEX, you must be able to absorb what you're studying, and you must be able to clinically think through the questions and critically think through the questions. So if you don't understand what you're reading, if you have so much negative energy that you're not able to focus and absorb what you're reading, you will struggle with passing the exam. One last thing though, this is part of knowing yourself and part of surrounding yourself with positive energy. Know what works best for you. The fact that your friend spends 10 hours in the library and she's able to read and understand doesn't mean you can do that yourself. Know what works best for you. When do you test? When do you study best? Where do you study best? It could be on your bed. It could be in your house. Figure out a place that works best for you and do that before you. Use that area or that time as ways to study for NCLEX. Please, you don't have to be like everyone else. You're your own person, your own unique person. Figure out the thing that works for you and use those resources and materials to study for this exam. Again, please surround yourself with positive energy. It has been a pleasure. chatting with you guys today. Look forward to our next videos. We'll talk a little bit more about NCLEX, and we'll start discussing some NCLEX contents. See you guys later. Please don't forget to subscribe, and like. Again, I am Dr. Opara, and I am the trainer for Global Essential Services, also known as GES. Feel free to follow us on Facebook. We're on Instagram now, and you can also check out our website on www.G as in God, E as in Edward, S as in Sam, GESnursing.com, www.gesnursing.com. Thank you so much, and subscribe, like, and see you in our next video. Thank you.